So first of all, dear friends of Nordics and Nordic friends, my name is Sami from Nordic Innovation House. I'm going to be your MC today, so it is my great pleasure to warmly welcome you all to our Nordic Health Program Investor Matchmaking webinar. And before we start, a couple of house rules as usual. Please note that all the participants are automatically muted. Please also note that this session will be recorded, and then the recording and the presentation decks will be shared with the participants in 24 hours. We will have a Q&A at the end, but feel free to post questions in the Q&A section whenever you have those. Please also then remember to indicate which company your question is for. And we do have a lot of old friends with us here today, but for our new friends, a couple of words about Nordic Innovation House before we start. So Nordic Innovation House is essentially a community platform accelerating high-quality Nordic tech startups, scale-ups, and growth companies that are coming to Singapore and using Singapore as a springboard then for the Southeast Asian market. And we are a strong community and a network. We are helping these companies to connect with the right ecosystem stakeholders. Nordic Innovation House is supported by Nordic Council of Ministers and Nordic Innovation, and we are quite unique collaboration across all the Nordic countries. And in our Singapore team are people from Visit Sweden, Innovation Norway, Embassy of Finland, and Promote Iceland. And I would say that our daily work is very industry agnostic, but then we are running these market entry programs in key verticals such as smart cities. That program will take place in October next month. Our sustainability and impact program will take place in Q1 in 2021. And in our med and health tech, which is actually the reason why we are all here today. And our program participants have met during last week over 160 health and medtech experts, mainly from the public sector side last week. And this week then we are focusing more on meeting investors. Companies are having one-to-one meetings. And then on top of our closing event on Friday, where we will discuss then how different innovation platforms in healthcare are evolving in Singapore and in the Nordics, and what potentially these platforms can learn from each other. And of course, you are all most welcome to also join to this session, and the invitation link will be posted in the chat shortly. But then let's have a look at our agenda today, which is pretty straightforward. We have 17 companies, each company is pitching 5 minutes, and then we have a Q&A at the end. Before I hand over the stage to our excellent med and health tech companies, I just want to mention that how you can connect with these companies after this session. So you can book a meeting with them using this link. That link also will be posted in the chat. Or then you can provide us the list of the companies who would like to meet, and then our team will help to coordinate those meetings. Then basically, without any further ado, let's go to the pitching. And we have actually categorized all the companies in 4 different groups. Group number 1 is all about digitalization, different professional communications platforms and solutions, and also IoT. Group number 2 is medical devices, screening, and clinical solutions. And then our group number 3 is indoor spaces and furnitures. And the group number 4 is then other companies where we have 2. Good. Without any further ado, I'm going to hand over then to the first company, which is Crayon, and Crayon will be presented by David. David, over to you.
All right, can you hear me?
Yes.
Great. All right, thank you very much for that introduction, and it's a pleasure to present to you today. My name is David Bergendahl. I am the head of AI at the Crayon AI Center of Excellence here in Singapore. So Crayon is a listed company in Norway. We have 1,600 employees in 35 countries, which includes 6 in the APAC region. We have 5 AI Center of Excellences practices globally, and our data scientists works across the world to build smarter solutions for tomorrow. So our expertise lies more in co-development of solutions together with our customers to solve real-world problems utilizing AI, machine learning, and IoT. So something that we call IoT, AIoT. Now, this is a little bit different from the other presenters today, but our goal here is to show what we can do and see how we can support your portfolio companies with our knowledge and expertise. So we have done more than 100 successful AI projects and deployed globally. And we do this by using our proven proprietary AI development framework. And this approach earned us the award of the AI and Machine Learning Partner of the Year with Microsoft in 2019. So since today, we're talking more about the healthcare industry solutions. We have built a large amount of solutions that is helping healthcare providers to reduce operational costs, to increase efficiency, and improve care in new and innovative ways, which ultimately has helped them to provide a better service to their patients, which of course is key. This was made possible as we provide our customers with an end-to-end service. So we start with education, then we do workshops, and then in those workshops identify an AI strategy and potential machine learning projects that we then collaborate to deploy and develop with them. So we provide a end-to-end solution because we have learned that you need to help customers to pinpoint their pain points that can be solved using machine learning and then provide them with that measurable value that they're looking for. So some examples include heart condition diagnosis through machine learning, skin type classification and recommendation service through image recognition, and privacy protection for data collection. We also have experience to collaborate with large organizations in both the public and the private space. So Crayon currently is responsible for delivering IT infrastructure to the Norwegian healthcare system. And we are also proud members of APAC Med as their first AI and machine learning subject matter expert. So now I'd like to share some cases that I thought would be relevant, but we have many, many more in a wide range of industries that I'd happily share more to you about in a one-on-one. So to start off with, this is as you might know, there's an increase in colon cancer cases in the past few years, and inspection and diagnosis can take a long time, especially in countries that have a public health care system. So by collaborating with one of the world's leading subject matter experts, we developed a model that used computer vision and machine learning that can accurately identify a type of polyp and if it is malignant or not in real time. So this model helps increase screening efficiency and also helps to initiate the correct treatments earlier. We also developed a preventive system that has helped Norwegian hospitals to avoid patients to fall out of their hospital beds by utilizing 3D cameras. So through image recognition, we're able to identify behavior that would indicate if a patient is about to fall out of the bed or try to get out of the bed after a surgery. So what the system does is that it automatically alerts nurses in the closest proximity. And if they do not respond quickly, the system will alert other staff to make sure that human intervention happens as quickly as possible. So the system is deployed and it has helped the hospital staff to react in time in order to avoid patient injury. Finally, we developed a system for automatic email routing of highly complex email queries by utilizing a number of natural language processing models. So this group of models, which we call DATE, is able to quickly and accurately classify the content and who is the right subject matter expert to answer a question and route it to that person. So the system has helped this organization to guarantee a 4-hour response time, and it is able to accurately automate or route about 82% of all emails, which has resulted in a significantly reduced handling time and increased efficiency and improved customer service. So that was what I wanted to share, and I look forward to discussing with you on how we can partner and share our expertise and knowledge with your portfolio companies. Thank you very much.
Great, thank you so much, David. And our next company is also coming from Norway. It's Dossier, and we have Christian Wamberg presenting. Or do we have Geir? Sorry, Geir. Yes, over to you.
Thank you. I'm Geir Arnoff, and thank you for having us. I'm the CEO and the founder of Dossier, and we are a Norwegian software company working within what we call competency management in healthcare. If you walk into any department in a hospital, you will find clinicians like life in this picture. And a typical nurse in a healthcare facility or a hospital will typically need to meet more than 100 competence requirements. When you look into those requirements, you will see that a good majority or a good part of them, in this case around 30 requirements, is related to training on different types of medical equipment. And there are a good number of the requirements, in this case the red ones, that indicates the requirements that should be renewed annually. And the nature about these requirements is also that the learning comes from so many different sources. So this is a big set of management that need to be kept track on with the requirements in the back end. And when you scale that up for a full department, where there are like 30 to 50 direct reports, the managers, they need to keep track on a huge set of competence requirements to make sure they meet the quality standards and ensure patient safety through their regular treatments. And this is a quote from one customer we just recently implemented here in the United States. And in this case, Gary Hoare, the pharmacy director, which I learned to know very well personally, he had Joint Commission coming into his office as they do once a year, and they point to one specific employee and say, well, show me the records for life or any other of his staff. And he used to need to run around and run reports from different systems, keep notes, and also keep some paper binders with his in-service trainings that has been happened. And he just recently started to use Dossier to pass his Joint Commission audits and demonstrate his compliance in regards to competence requirements. And scaling up for full hospital, this is of course large savings directly on the time, but the majority or the big part of it is the qualitative savings and the qualitative increase in patient safety and better use of their learning resources. You should probably think that there is a learning management system in the hospital taking care of this, but the fact is that the requirement comes from so many sources. So just need to, and the learning management system only take part of some of that because Dossier is the framework that connects all the requirements to the specific sources that deliver learning in the hospital. And this is something they use to be able to monitor their excellence. Most recently, they have been using our tools all across to ramp up COVID capacity. And they also feed their shift planning system with data from Dossier. Sorry. Our system is implemented throughout the full Norwegian healthcare sector. We are in several large healthcare systems in Denmark and Sweden, and we are just happy that we secured funding to ramp up our market expansion in the US. We are, of course, also working with Singapore, as you guys know, and we are out looking for partners and for anyone that think this could fit into what they are working, and we have a very partner-centric business model. Thank you.
Great, thank you so much, Gary. And our next company is also coming from Norway. We have Imatis and Dan Credazzi is pitching. Dan, over to you.
Hello, thank you. I share screen. There we go. Thank you, ladies and gentlemen. My name is Dan. I'm calling from the Imatis Sydney office. We've recently opened an office in Singapore, and we have offices in Norway, Denmark, Italy, and Saudi Arabia, and the US. We are a Norwegian software company that specializes in integration and patient flow portals. Our story starts over 30 years ago under the North Sea, integrating critical oil and gas flows through multiple systems. And we've parlayed that experience into the healthcare sector over the last 17 years with our integration and business rules engine, creating portals that are useful for anyone, be they patients, nurses, doctors, orderlies, porters, cleaners, kitchen hands, or others in the healthcare network. Our software is, we can divide it into two parts. The business rules engine, which integrates with all the heavyweight systems in today's healthcare environment, and the portals, which are flexible, changeable by our clients, and role-based, be they for a nurse or a doctor or a patient who's checking into an outpatient clinic, for example. We'll show you some examples. I mentioned heavyweight systems. These are the EMRs, pathology, imaging systems, communication systems, PAS systems that are inherent in every hospital on the planet, and every one of them is different because inevitably there are different versions and such. The alternative we present is a single portal integrated to all those information sources so that access is regulated and the information that's necessary in real time is available in real time. That's in an emergency room ported onto a mobile device here. You can see results of pathology integration, meds management integration, clinical notes, the Active Directory for the staff, nurse call integration, the PAS or EMR, and we can communicate with anybody with a tap on staff, on duty, any staff on duty. So that same portal propagates into the wards of a hospital, and when it goes across a hospital or group of hospitals, we can aggregate the KPIs in our pre-configured management boards, but these are, we can change the configurations at will. And one of the best things about our lightweight IT, I mentioned the portals are changeable. We train our clients to perform level 1 and level 2 customer service. So we only need back to factory level 3 calls back to base. And after that training, they can configure their own portals. I'll show you some examples. The best are from the recent COVID crisis back in March and April. 4 of our Norwegian hospital clients created these portals on their own using the installed version of Imatis with the existing integrations, and their super users and IT administrators we had trained created these portals for use in their districts. Without calling us, we found out a month later after we requested screenshots. That's the power of our tool and the fundamental difference in our lightweight IT approach. Our existing clients, super users, use our portals to create lean workflows and perform nuanced orchestration of patient flows. What we wanted to mention tonight is that we're interested in connecting with greenfield hospital builds, such as Woodland Health Campus in Singapore, or the new Princess Alexandra in London. These forward-thinking digital hospitals that want to open with a HIM6 or better, we would like to talk to them, or if there are any connections available. This is what happened in Kalnes with, while we were involved with the design phase from 2014. And finally, I wanted to close with a mention of our IoT integration. Down here, you see we connect with the heavyweight facilities management systems. So in the Royal Adelaide, we connect with the with the AGVs, the lifts, the lights, the door locks, such that in a code blue situation at the Royal Adelaide, a nurse can push a button and we can reserve a lift to the next floor, send alerts to the on-duty team, mobilize a porter, reserve a bed, and we can all do this automated in our rules engine. Thanks very much. Look forward to following up. Thank you.
Great. Thank you so much, Dan. All right. Our next company comes from Finland, and we have Sami Rauhala, who is the VP of Sales in APAC, presenting with Gunnar. Sami, over to you.
Thank you. And the presentation should be visible now. So, I'm Sami from Quppa, and Quppa is a technology company focusing on answering the questions who, what, when, and where. So we do high accuracy tracking in real time. We use Bluetooth technology, but a very unique method called direction finding. We do this presentation together with Tietoevry, which is a large system integrator in the Nordics, expanding together with us to your region at the moment. And we do this also with Medisys Innovation, which is a medical industry software provider in Singapore, our partner as well. Why we do location-based services in healthcare? First of all, we do it in order to save lives. And secondly, improve operational efficiency, reduce costs, increase security and safety within the premises, as well as enhance the user experience for all those people who come and visit the hospital, be it contractors or visitors and so on. And now in this COVID-19 situation, some use cases have been raised up and are queried a lot, which we have done earlier. One is hand hygiene control. So we have possibility to check if the hand hygiene procedures within the hospital premises are followed. Another one is, well, maybe related to that, on the right-hand side, you can see that around 80,000 people alone die in US annually because of pure hand hygiene not being followed. Then second thing is the contact tracing. So we have ability to trace actually patients, nurses, doctors, and any external people who met whom in real time in the premises, as well as backwards in time. We can check what actually happened if someone is found to be COVID positive. And all these patient and employee movements inside the buildings. Our partner Tietoevry has developed a digital twin solution for this, and Gunnar Hansen from Tieto will share in the next slide about that. Over to you, Gunnar.
Thank you so much, Sami. So, Empathic Building is a startup from Tietoevry, was established in 2016, and we have already delivered this to, this slide says 12, we are now 16 countries and fast growing. The solution is a visualization tool, which is totally agnostic to any sensory input, and we have been doing this quite successfully with Quppa for many years. With high accuracy and a system which works from day to day and is a stable and a good solution. So what we want to achieve is to build a digital twin. This has been done quite fast, and to have the customer being able to have the same visualization tool, even though technology changes along the way. We have an installation at Qlucore in Singapore, and we want to expand also now. So we are taking this from the office site into the hospitals, building up digital twins and expanding quite fast. So thank you. Over to you, Sami.
Yes, some of the benefits of our technology I would like to highlight to you. They are unique. First of all, it's very accurate. We are talking about 10 centimeter accuracy when needed. Typically we focus 0.5 meter when measuring people's movements, people movement inside the premises. It's versatile. We can use all kinds of Bluetooth devices, badges, wristbands, asset tags, and so on, as well as mobile phones and tablets can be tracked. It's infinitely scalable, so we can do campus size implementation as well, or even city level. And maybe most important, it's very open, so you can integrate this technology also to pretty much any existing hospital management systems such as Epic and so on. There is one example of a Norwegian hospital. Gunnar, you want to mention something about that?
Yeah, this was the first hospital site we did, 19,000 square meter. We did that model in 2 days. So this is how fast we do this. And we are really now looking for a hospital in Singapore who wants to have this model built. And then we can take in all the sensor information you already have and also combine this with Quppa sensors.
And to summarize here, so we are the 3 companies offering this solution together. And Quppa, we are currently in 58 countries and 2,500 implementations roughly around the world. And with Tieto, we have a long experience in doing digital twins of the buildings and now expanding with these hospital implementations towards Southeast Asia and Singapore especially, to go together with Medisys Innovation that has long experience in providing software in this area. Thank you very much. Happy to hear from you later on.
Thank you.
Thank you, Sami and Gunnar. All right. Our next company also comes from Finland. We have a Secapp and Dr. Kari Aho, who is the CEO and co-founder, is presenting. Kari, over to you.
Yeah, great. Good afternoon. My name is Kari Aho. I'm the CEO and co-founder of Secapp, as Sami already mentioned. Let me share my screen as well. So next we're going to be talking about critical communications and alerting. And the mission behind what we are going to talk about that is that we are trying to help you to save lives and minimize the impact of different crises, whether they are COVID-19, terrorist attacks, infrastructure failures, extreme weather conditions, to name just a few crises. Secapp has already helped many verticals for better emergency response. For example, we've helped ministries of health, hospitals, ambulance, and volunteer services in 2 major regions, namely Europe and Middle East, to respond to various emergencies in a matter of seconds and mitigate the impact of COVID. For faster market entry, we utilize normally partners and distributors and have already created agreements with leading multinational organizations such as Airbus Defence and Space and Saudi Telecom Company in the Middle East. Secapp has already over 83,000 professional end users, and we are now striving to make an impact in Singapore. The big picture behind Secapp is that when we are facing these unexpected situations, whether they are emergencies, disasters, infrastructure failures, it means the ability to react within seconds, not in minutes, not in hours, and definitely not in days. Failure to do so might lead to loss of lives or at least to substantial costs, not being able to run your critical operations. Secapp is built to meet that critical need of efficient emergency response while not forgetting how that reflects into daily operations and running them. In summary, Secapp is a SaaS service for effortless critical communications and alerting that will capture your attention when needed. It allows to send and respond alerts in a matter of seconds, whether there's a small group of nurses, doctors, technicians, management, or even the whole organization. It provides a platform to exchange information through chats, videos, and checklists in a secured environment. And the best part is that it's not just an application, but it works with any device being able to communicate with older as well as newer devices. It also integrates to other systems with ease. And if we continue this notion further, some of the key highlights of Secapp are that it can actually bypass the silent settings at the end user devices. You also own all of the data, making it secured for even running the critical operations. In short, Secapp basically removes the need to spend huge amount of time on a phone, which can be very harmful when running critical operations. From end user or end customer perspective, we've got 3 equally strong footholds, namely in private, public, and authority segments that use Secapp to prepare, react, and manage crises as well as their daily operations. Currently, these 3 segments total into 144,000 euro monthly recurring revenue. Each of these segments reduce our business risk as well as strengthen each other. For instance, would you buy a SaaS service from a company that also sells that to the authorities? At least I would do so. And what we are looking for is twofold: interested investors for an opening investor round that will be available towards the end of Q4 this year or in the beginning of next year. The goal is to boost our sales, especially through international distributors. And the second aspect is to expand our distributor and partner reach with revenue sharing model, which benefit, of course, both parties. We have already very good experience in doing so with telecom operators, vendors, as well as security and IT companies. Thank you for your interest. Feel free to contact us if you're interested. As mentioned, we are Secapp. We are ready to help you to save lives and keep your critical operations up and running with ease. Currently, we have operations in 9 countries, and we are looking to expand that to Singapore, to name one example. Our expected growth this year is, through our existing agreements, already past 100% and looking to expand that even further. Thank you.
Great. Thank you so much, Kari. Next company is coming from Norway. It's VAR Healthcare, presented by Andrew Watson. Andrew, over to you.
Thanks, Sami. Can you see my screen?
Yes.
Good afternoon from Oslo. My name is Andrew Watson. I'm the International Sales Manager for VAR Healthcare. And we provide a clinical decision support tool for nursing education and practice. We are an established company. We're owned by one of the largest publishing houses in the Nordics. So we're not looking for funding. What we're looking for is if there's connections into our target customers, which is education, hospitals, community healthcare, health institutions, and authorities, or if there's the potential for partners for further development of our technology to better present our content, which is evidence-based. So we have a proven track record of innovation and implementation that's changed evidence-based practice in the Nordics over the past couple of years. We've established also market share in Germany and Switzerland, and we're looking at Singapore for our first market entry for English-speaking countries. The challenges and problems that our solution addresses is that local procedures vary significantly across units and hospitals. The staff is unable to keep up with research and best practice development, and that in turn leads to a discontinuity of care and inconsistencies in treatments. There's also insufficient documentation and lack of interoperability and comprehensive decision support for the staff. And furthermore, the staff are not adequately prepared for clinical practice from day one. The consequences if these challenges aren't properly addressed is a risk of incorrect treatment and poor patient outcomes. There's an ineffective use of time and resources at the hospital or institution. There's an atmosphere of uncertainty and lack of trust, both between the patients, but also between colleagues. And that in turn leads to ineffective information exchange and poor communication across professions. Finally, and perhaps most importantly, there's discrepancies. What we offer is a solution of both technology and content that supports clinical practice in making rapid and qualified decisions. We offer better documentation, which leads to better patient outcomes, which are based on evidence and up-to-date procedures, knowledge, and tests. Our solution is one for lifelong learning of the staff. We make evidence usable for the staff of the institution. We're a clinical decision support system that's ready for use as it is. It's extremely user-friendly. We have a responsive design that is the same display on PCs, on tablets, or on telephones. It's web-based. There's free private use when they're not in the institution working. It's ready for integration into electronic patient systems, health records, quality systems, and also for learning platforms. And we've done all those integrations in the Nordics. We also have additional extra modules for clients if interested. We have one system that ensures quality and continuity for the entire chain of healthcare, primarily for patient care and treatment, but also for education, competency development, and research and development. Regarding interoperability and what we're able to do, we can go from a problem to a solution in one click. You put into automatic search for content, in this case dizziness, it backends with our system, and then provides actual related or additional procedures in the electronic patient records system. Regarding return on investment, we've already shown quantitative savings with our partners, a hospital in Norway or municipalities in Denmark, which ranges from 25,000 to 70,000 Singapore dollars per year. Maybe equally important are the qualitative savings, that there's improved quality of care, patient safety, improved patient flow, and better communication. And then there's a continuity of care for the patient, and also less turnover for our partners. We serve as a bridge between research and practice and allow then our hospitals to utilize resources and ensure an implementation of new technology and evidence-based practice. So that's an overview of what we do. Please feel free to contact me or our director, Dr. Ann-Christine Rultegård. There's also a link to our video on our website, which summarizes what we're doing. And again, to recap, we're looking for connections to those key partners that we're looking for, or we're looking for development of our technology, for example, blended learning, visualization, virtual reality, etc. Thank you very much for your time.
Great, thank you so much, Andrew. Okay. Our next company is coming from Sweden. It's Scientech, and will be represented by Sebastian Siliakos, who is the Vice President here in Asia. Sebastian, over to you.
Thank you, Sami. Okay, good afternoon, ladies and gentlemen. My name is Sebastian. I'm the Vice President Asia for Scientech. Scientech was founded 2015 in Sweden with the vision to automate the process for companies to identify their customers digitally in real time. Since 2015, we have expanded to further regions outside of Sweden, namely US and Czech Republic, as well as Singapore. With further good success in the European market, we listed a company on Nasdaq last year, 2019. And to further support our expansion in Asia, we recently also acquired an award-winning Singapore company called Basis ID that complements and localizes our identity verification services, such as Know Your Customer, Know Your Business, and anti-money laundering services. So what do we really do? Scientech is a global identity service platform in the regulatory technology space for both regulated businesses and non-regulated businesses, such as the healthcare sector. We have companies struggling with having to manage multiple contracts and technical integrations to support the global customer KYC, KYB, compliance and anti-fraud processes, and this is where we come in, where we offer one global platform that enable companies to combine multiple identity methods for onboarding customers and doing anti-money laundering checks to become and stay compliant with global and local regulations. So our business model and vision is to become a global regulatory tech aggregator with multiple local services. Now, focusing in on the health sector, through our interoperability identification services, patients and doctors can safely and securely conduct online consultations, such as telemedicine, access their prescriptions and medical records throughout over 200 plus countries, which combine is what we call digital healthcare. Now, how do we verify customers and patients across 200 plus countries? Our solutions allow for a waterfall implementation where we orchestrate solutions for our clients so that the most used identification method in a particular country is offered to the patient. In the health sector, this is specifically important for medical tourism, who can be identified in advance and offered possibility to access prescriptions and consultations from their home country when they fly back. As a Singaporean company, we are also integrated with SingPass for an easy onboarding process for Singapore residents. Additionally, we have services such as real-time AML checks, real-time payments, PEP and sanction checks. We are integrated with banks and so forth. Now, these services and solutions can be implemented via an on and off configuration switch through one single API. If further patient profiling wants to be achieved, we have 3 different ways a digital solution can integrate to our platform. One is through a web SDK that can be rebranded. It can be a REST API, and it can be a mobile SDK, which is available both for iOS and Android. Now, the market size for regulatory technology is quite amazing, and the regulatory space is increasing and fastest growing region in APAC, and the reason why we set up a Singapore company as well as an acquired further company here in Asia. We are in multiple different sectors, as mentioned before, whether they are regulated or not regulated. Some of the sectors that are not regulated are health sector, e-commerce, travel, and retail, among others. Our revenue models are either a monthly fee, which is based on a committed yearly volume of checks, or a pay-as-you-go functionality, which is based on transaction fees. Now, we are not actively looking for funding in the region, but we are looking to further expand in Asia through partnership opportunities, as well in both regulated and non-regulated sectors, as well as M&A opportunities. Thank you very much for your interest and looking forward to one-to-one sessions.
Great, thank you so much, Sebastian. So that was our first group, which is about digitalization, professional communication, and IoT. And now it's time to move forward to group number 2, which is about medical devices, screening, and clinical solution. The first company in this group is coming from Norway. It's Ably Medical, and we have Tuva Freeman presenting. Tuva, over to you.
Hello, can you see my screen or no?
No.
No, okay. I'm having some difficulties today. Sorry about that. Let's see. I'm sorry, Sami. I'm having some issues. Does it show now? Yes, you see me. Is it okay?
No. Okay, something's happening now.
You're not seeing my screen?
No.
No. Okay.
Hey, Tuva, let's see if this works.
Let's see, I'm sorry, I'm had to work from home today, so it's using a different computer. I'm so sorry about this.
Tuva, we give you a little bit more time to sort out the technical issues, and while doing that, we will take the next company.
That sounds good, thank you.
Come back to you later on. Next company is then Adesante. We have Petteri Joenpolvi, their CEO, presenting. Petteri, over to you.
Thank you so much, Sami. And like you just kindly introduced, my name is Petteri Joenpolvi. I am the CEO of a company called Adesante, whose flagship product is surgery vision. Our company vision is 0 surgical failures, and you will hear later on what it stands for and where it comes from, actually. Annually, 310 million patients are going through surgical procedures, and 50 million of those are suffering complications after the surgery. In US only, 4,000 patients are facing surgical failures, and 60% of these surgical failures are causing temporary injury, luckily only temporary, but 33% are causing permanent injury, and 7% even wrongful death. For the company who is able to solve that challenge of those surgical failures, there is 250,000 clinics waiting for that solution. meaning if a product average monthly price is 2,000 euros, the market size is 5 billion euros annually. And if estimated price for final product, let's say the mature, having all kind of features which you will hear soon, the market size will be 50 billion annually. And what is the best thing, there is no competitors in this market yet. The solution which solves the problem just described is called surgery vision. It is utilizing existing imaging data from a hospital by loading that data into three-dimensional stereoscopic format in few seconds by letting surgeons to make the surgical planning directly into that image. The product is fast and easy to use, and it fits to the hospital process, and it fits to the hospital's existing hardware environment. It does not require too much additional work for them. It is just wearing virtual reality headset and diving into the human body for doing the surgery planning better than ever before. By doing that, the existing customers have counted that if they have 10 operating theaters operating 2 patients per day, the cost savings are 25,000 per week, meaning 100,000 euros per month. And multiplying that by 12, you will get their annual savings. But a significant number of the money, which they are willing to spend for purchasing the system called surgery vision, for example. That is the product what is available already today. And last week, we got first prototypes ready for the product new module, presenting automatically the abnormalities from a human body. Doing the segmentation of the organs, defining the tumor here in the liver, for example, creating the liver and the tumor together or independently, three-dimensional model for the surgeon for having better understanding how it works and how to operate it. The product is already in the market, but it is developing further for sure. 2 years ago, 1.0 was released for viewing those images only. More than a year ago, 2.0 version was released for planning the surgical procedures. Today we are here preparing the surgery vision 3.0 together with artificial intelligence, which you just saw, for highlighting automatically those abnormalities and making planning faster and easier than earlier. For next 2 years, that planning image needs to be placed properly on the patient while operating, and then at the end, letting robots to operate human beings, starting from very shallow tissue procedures, but then going deeper and deeper into the intestinals of the human body. Like mentioned, Surgery Vision 2.0 is ready. It is in the market, having paying customers, big university hospitals, which are expanding their install base, presenting that product. It really provides the value it promises. The distributor network is available, and now it helps to solve the described problem. We, as a company, are looking at investment, roughly 3 million euros with 50% pre-money valuation for scaling up in Asia, Europe, and Middle East, and for taking product into the next level. After today, kindly book a meeting with me for having more detailed discussions and for hearing more about Adesante and Surgery Vision. Thank you so much.
Great, thank you so much, Petteri. And then move forward to Prider. They come from Sweden, and we have Johan Möller presenting them. Johan, over to you.
Thank you very much, Sami. So I'm going to try to share my screen. Are you able to see it?
Yep.
Okay, perfect. Johan Möller from Brighter, Sweden. We're a company working with remote diagnostics for chronic diseases and self-management. We're targeting diabetes now, and in Southeast Asia alone, there are some 28 million people with diabetes last year, expected to rise to around 50 million in the next 20 years. Around 1 in 12 adults have diabetes today in Southeast Asia, but almost more than a third of them are undiagnosed. This is of course leading to a lot of problems, and we unfortunately see around 300,000 deaths per year coming from diabetes alone in Southeast Asia. There's also huge cost related to diabetes worldwide. It's the most expensive disease, and in Southeast Asia alone, around $16 billion were spent last year, and that's projected to only increase with prevalence increasing, as well as the cost of the complications of this chronic disease is also increasing. On the cost side, around 10% of the cost of diabetes comes from the treatment, whereas almost 90% or more comes from the complications. These can be, for example, sight impairment, diabetic foot, etc., cardiovascular problems mainly. These complications arise because people get the disease, they might not know that they have the disease, and then unfortunately they don't treat their chronic disease well enough. So non-adherence to a treatment recommendation is main source of the cost. And that's where Brighter comes in. Brighter has developed a solution that allows patients to monitor their diabetes themselves and let them share the data with their physician. This was tried in 2017 in Singapore using the telehealth app MyDoc. What was seen was that the number of visits went up 5-fold, whereas the cost of the inpatient admissions went down 5-fold. The Brighter solution starts with a patient using a device to measure their own blood glucose levels, as well as injecting insulin. This data will then be made available to the healthcare professionals that can give feedback on the treatment of diabetes. We have an app which lets the patient tag if they've just eaten or if they've just exercised in relation to the verified real-life injection and blood glucose data that we collect from the device. And this will be the same data that is then made available to the healthcare professionals, where they can see the trends of the patients and follow them up on an event basis rather than on a scheduled visit. The device is split into two parts. We have one for orally medicated diabetics that has a storage compartment for the tablets, as well as a version for injected insulin, where we also measure the amount of insulin injected. Currently, we're deployed in Southeast Asia in Jakarta, where we're working with Health Agency of West Java in Bandung, offering 100 patients the use of the ACTIST service for 6 months so that we can see how it fits the local healthcare system, as well as how we should shape our offer to be relevant in the market. And we're targeting all the markets in Southeast Asia. Of course, our center will be in Singapore. So what we are looking for is both partners that we can work with. That would be all companies in healthcare, either that have patients or centers of excellence of chronic diseases. And of course, going forward, as we scale up operations, we're also looking for investments to speed that up. So please contact me and book a meeting for next week if you'd like to discuss our specific timeline for different countries and how we can work together. Thank you very much.
Great, thank you so much, Johan. All right, and let's try Tuve and Ably Medicals again. Tuve, you want to try?
Great, hello everybody. I'm sorry about that.
No worries.
Let's see. Is it working again? Let's see.
If it's not working, I have your deck here, so I can show you the slide.
So you could do it if possible?
Yeah.
Okay, then maybe we just have to do it that way, Sami, because
All right.
perfect. Okay, we'll just take it as it goes.
Yeah.
Perfect. Hello, everybody. My name is Tova Freeman, and I am here from Ably Medical's Business Development Department. Ably Medical is a preventative healthcare company, and we make products that better patient outcomes by reducing the physical and mental burden faced by today's nurses. Our main product, Ling, is a multidimensional patient monitoring platform that has the potential to replace both existing nursing logistical tools and traditional patient monitoring instruments. Ling aims to address the three main challenges in nursing: the clinical efficiency, 2, patient safety and adverse events, and 3, optimize management of care. By providing continuous, contactless patient status monitoring, Ling eliminates manual and tedious processes like taking pulse or respiration, and it presents this data in an intuitive way. Ling is able to support clinical decision-making and aid in clinical workflows, in addition to improving patient comfort through removing cumbersome wires. Then the next slide. There are 3 main components to Ling: the sensor mat, which collects the data, and the activity data and vital sign data. And then to the bottom, you'll see the data center. This is a computing box which performs the analysis and allows for third-party devices to attach, such as thermometers and SpO2 monitors. The third part of the system is a dashboard, which allows for the visualization of data. Then I'd like to present our business model. This is a subscription-based model which provides fixed revenue and a potential for upscaling through software apps. The way that the system works is that we have a €350 installation fee, which we have for each mat, and then there is a €70 rental fee, also per month per mat. In addition, we also offer software features, which then cost about 15 to 20 euros per app per patient. Through our shareholder analysis, we have found that this is the preferred business model for our key customers, which are hospitals. Then the next slide. Here you will see our ambitious expansion plan with revenue potential of approximately €500 million over 10 years. This model shows both an ambitious and a conservative figure, and it's based off of a multi-country and multi-market penetration strategy. Next slide. We are aiming to establish ourselves in Singapore as a gateway to Asia, doing clinical development studies in 2021 and market entry through our hospital partners in early 2022. In that regard, we are now looking to find investors in Singapore that could accelerate our Asian strategy. I would be happy to answer more questions about our investment strategy for potential investors in a one-to-one meeting. Thank you very much for your patience and for listening to the presentation. Thank you.
Great, thank you so much, Tove. And then our next company comes from Finland. It's called CryoTech Nordic, and we have Jean-Patrick Martins presenting. We can't hear you. We can't hear anything. Still nothing. Okay, Jean-Patrick, maybe we come back to you shortly, and we take another company before that. So let's move then to the Iceland. We have a company called Retina Risk, and we have Silla Jonsdottir, the CEO, presenting. Silla, over to you.
Thank you very much. Good morning, everyone. I'm very pleased to be here today and have the opportunity to present to you Retina Risk. Everybody see the screen? Perfect. With nearly 500 million people living with diabetes worldwide, and diabetes still being one of the leading causes of blindness, the problem that we are trying to solve is enormous. But with early detection and timely treatment, vision loss can be prevented in 95% of cases, saving the sights of millions. And this is what we are all about. The novel and clinically validated retina risk algorithm offers a new approach focused on first, empowerment of the patient, and second, streamlined and personalized eye health care based on risk prediction. We offer two products, the Retina Risk app and the Retina Risk API solution. The app empowers people with diabetes to calculate their individualized risk of developing sight-threatening eye disease based on their risk profile, namely gender, type and duration of diabetes, retinopathy diagnosis, blood sugar levels, and blood pressure. The app allows patients to better understand their condition and motivates them towards enhanced diabetes care. We are raising awareness and providing patients with information that helps them manage their diabetes and related health decisions. The app has been downloaded by over 500,000 people in 150 countries around the world in the last 6 months. And our goal is to reach 1.5 million downloads by mid next year and convert 3% of them to paying customers. The Retina Risk API solution is a system-to-system solution that increases the clinical safety of diabetic patients by identifying high-risk patients who need immediate care to prevent vision loss. By stratifying and recommending variable intervals for eye screening based on the patient's risk profile, Retina Risk enables hospitals and clinics to streamline eye screening to make it more efficient and cost-effective. Clinical validation and real-life use of Retina Risk in countries like the UK, Norway, Netherlands, Spain, and South Africa show that personalized risk-based eye screening leads to the following: increased clinical safety. The Retina Risk recommends eye screening for high-risk patients every 6 months, opposed to the current annual one-size-fits-all approach. Second, leads to 40 to 60% fewer eye screening appointments for low-risk patients without compromising clinical safety, thereby liberating valuable time in clinics to be used on high-risk patients and increased capacity in high-prevalence diabetes areas. And third, reduction of 40 to 60% in healthcare cost. All of this is vital, recognizing strained healthcare budgets, shortage of physicians, and growing pressure from waiting lists and overbooked clinics around the world. The COVID-19 crisis is having a dramatic impact everywhere, including on global eye health. Due to the outbreak, patients are skipping crucial appointments for eye treatment, resulting in thousands and even millions going blind unnecessarily. Eye screening of millions is being delayed, resulting in enormous backlogs when life gets back to normal. Retina Risk can help in several ways. First, by assisting hospitals during lockdown situations to prioritize which patients need to attend eye screening and who can safely stay home. Second, Retina Risk offers a scientific approach to deal with the large and growing eye screening backlogs by identifying high-risk patients. And third, with the Retina Risk app, people living with diabetes can themselves assess and monitor the risk of developing diabetic retinopathy despite halted services and seek timely medical assistance if needed. Our team is a perfect mix of the medical founders who have over decades worth of experience in diabetic eye screening and diabetes management, and the software and management team that has the stamina to bring Retina Risk to every person living with diabetes in every hospital involved in diabetes care. We are seeking $1 million to continue to grow our customer base, scale the team, and further develop our products with a clear ambition for the next 12 months. We are also interested in exploring partnership opportunities in Singapore, the gateway to Asia, where over 40% of the global diabetic population lives. I thank you for your attention and hope to hear from some of you to share more details. Thank you very much.
Great, thank you so much, Silla. And let's try CryoTech Nordic team again. Jean-Patrick?
Yes, okay, we have now checked the audio. Can you hear my voice?
Yes.
Oh, you can, okay, wonderful. let's start. So my name is JP Martins. I'm the Business Development Director of CryoTech Nordic. We are based in Finland and Estonia. Our manufacturing and research and development and technology is done here in Finland. Our frame and heavy manufacturing is done in Estonia. We are a 7-year-old company focusing on cryotherapy devices, which is actually a non-medical system, but has various medical benefits nevertheless. We have worked with a lot of athletes, clinics, hospitals around the world. We are currently exporting our products to over 35 countries. And we have therefore proven the market acceptance and consider ourselves as a scale-up company at this stage. We were established 2013 and now in the brink of global acceleration. Of course, the COVID-19 slowed us down this year, but we are confident that we can continue our growth exponentially from the beginning of 2021. Our systems are used not only by physiotherapists and medical professionals, but they're also used and endorsed by top athletes like Kimi Räikkönen and hundreds of others. And by the way, the gentleman in the gray sweater in this picture is Kimi Räikkönen, the Iceman himself. And he became our client and very satisfied user of our cryotherapy equipment last year. And we have now a 2-year contract with him, and he's our global ambassador. And we hope that Kimi will continue racing next year so that we can continue working together with him and maintain him in competitive order for many years to come. So now you probably are wondering, what is cryotherapy? Cryotherapy is cold therapy using extremely low temperatures, and the target is to create a thermal shock. And it is a only known treatment method at the moment that opens the key to our so-called internal pharmacy. It's really a bummer that we have all these health supporting and healing enzymes and hormones in our system available, but with our conscious mind, we can't access them. So by creating this simulated life-threatening condition to the superficial cells of our body, either localized or the whole body, we can successfully give help to muscle pains, we can alleviate skin disorders, all kinds of injuries. Post-surgery recovery will be accelerated, and it is also very efficient to maintain overall well-being, including psychological and mental wellness. And basically any part of the body can be treated. In the picture there you have a cryo mask, which is a cryofacial treatment for a couple of minutes. And that one is particularly efficient to boost up energy levels, increase focus, and get rid of toxins in our blood circulation in the head area. We are now changing the game by introducing an electricity-only operated localized device, an X-Cryo. You can see it operating here, the mask with Kimi Räikkönen. It is also on the lower right-hand side corner. It is used for physiotherapy for different joints. In these pictures, you are treating the elbows, but you can treat similarly knees and any inflamed or injured joints that you wish to get recovery for. And of course, in the pictures, you have also the whole body cryotherapy, where we go to minus 130 degrees Celsius, and we get a complete response from the body, including increased levels of hormones like testosterone and androgen and etc. So we are now focusing completely on the electricity-powered cryotechnology, and this makes this treatment discipline available and affordable and very easy to implement and use to a very wide audience globally. And what we are doing now, we are in the middle of private placement. We are raising 2.5 to 5 million euros. The pre-money valuation for the whole group has been set at 25 million. It's a practically debt-free group. With the IPR valued at over 23 million euros last year. And we are offering from 10 to 20% equity in the parent group. And obviously a proper investor deck and proper audited numbers is available upon request. We are also open for one-to-one meetings. So if you wish to book one-on-one meetings with us, we'd be delighted. And we can do that after this session is over. And here is my 5 minutes, and I hope you enjoyed it. And we look forward to hearing from you. Thank you very much.
Great, thank you so much, JP. Very good, so that was the last company from group number 2. So it's time to move forward to group number 3. First we have ISKU Interior, which will be represented by Jonas Wikström. Jonas, over to you.
Thank you, Sami. I'm trying to share my screen first, so I hope you can see it now.
Yeah.
Wonderful. So yes, like Sami introduced me, I'm Jonas Wikström. I'm business manager at ISKU Interior, and I have with me here Sarah Hu, also who's our chief representative of our Asia Pacific markets. And a couple of words about ISKU. So ISKU is furniture manufacturer, designer, and sales company, and we have done so for the past 90 years. So we are a bit mature company already. We are today showcasing you ISKU Plus antimicrobial concept, and that's something we have developed throughout the past 7 years. So that's not a new thing at all also. But now in this era, it's picking up heavily, and we would like to further commercialize with customers and business partners, and that's the reason we are here pitching for you today. What is ISKU Plus concept? Let me tell you. So basically, this is the technology what we are combining with our furniture products. So we are using antimicrobial surfaces, and that means in practice, you can see it also here, that antimicrobial surfaces are basically reducing the time microbes can survive on these surfaces. So on the left-hand side, you can see a conventional surface, and on the right-hand side, you can see antimicrobial equivalent. So the bacteria in this one is E. coli, and the duration of this is 2 hours. And you can see clear difference that on the left-hand side, the bacteria population can survive, it can reproduce, and it's there for hours and hours. On the right-hand side, you can see totally opposite, that the bacteria cannot survive and it cannot reproduce. As a furniture company, we are using different kinds of materials, so we need to use different kinds of technologies as well. So this is the technology stack we are using. So BioCoat is one, so that's based on silver ions. It's an additive that we can mix into different materials such as laminates, paints, varnishes, plastics. And this allows us to have really holistic coverage to our furniture products with antimicrobial surfaces. And we are also using a lot of upholster products. So we are using fabrics, and there we are choosing fabrics which are using mostly this IGIS microshield technology. So that's based on organofunctional silanes, a bit different technology there. Then we are also using brass as such, and that's based on copper features, copper antimicrobial features. And we are using only EPA approved copper alloys, including this brass quality what we are using. And copper is also researched with COVID-19, and there we have really positive results. And with other technologies, the research is ongoing. Thus, researching with COVID-19 has been really limited and restricted from the commercial use. And these technologies are permanent. You don't need to renew them, you don't need to maintain specifically. So these are permanent features that we can have in our furniture products. So we can stretch the lifetime of these features as long as the lifetime of conventional furniture products go. The value proposition of this for healthcare sector, firstly, is that we can reduce the amount of infections, which leads to faster patient flow, faster passage, so efficiency. And for other working environments or other environments in public spaces in general, similarly, we are lessening the infections and we are reducing the amount of sick leaves. So thus we can provide really something which has really short payback period if we are talking about infections and sick leaves. A couple of reference pictures about this. So one reference from Istanbul. So you can see this children's hospital has a lot of colors, and we are using a lot of different materials. So we don't need to jeopardize design. We don't need to jeopardize colors. Hospital from Helsinki. This is hospital for newborn. Likewise, colors, different kinds of materials. And we can also do this kind of concept furnishing. So we can do some bespoke solutions as well. Some areas from Central Hospital of Lahti. So corridors, canteens, lobby areas. So all kinds of spaces. Example of that kind of brass coated tabletop. That's how it looks like. And one Singaporean reference customer that we have. This is unfortunately not antimicrobial, but you can get the picture that we can furnish quite a broad areas. Thank you for this opportunity. So we are looking for direct customers, business partners to find more customers. And also we are available for other cooperation suggestions, and please book one-to-one meetings with us, and see you there. Thank you.
Thank you, Jonas. Next company is also coming from Finland. We have a Vetrospace represented by Jonathan Cole, who is the Director of International Operations. Jonathan, over to you.
Thank you, Sami. Hello, everybody. It's a pleasure to be here. And I'll just try and share my screen now. Sorry, just give me 2 seconds. Great. Yes, so it's a pleasure to be here, and I'd like to introduce you to Vetrospace. We have been manufacturing ultra-clean modular pods since 2017, and in 2019 we launched our patented CME technology, a controlled microenvironment system. We manufacture technology within our pods that destroys viruses, bacteria, and other harmful particles in the air and on surfaces by integrating outside technologies that work together to provide the perfect self-disinfecting space. There are 3 critical factors that are needed in order to achieve the safe conditions that we create within our pod, in order to ensure safe and continuous air and surface disinfection with immediate, short-term and long-term results. The first technology we use is an air purifying ventilation system that and a smart airflow control that evacuates forcefully all airborne viruses and bacteria and harmful particles from within the pod. And this happens in a matter of minutes. But the air coming into the pod is actually purified through a double filtration system, meaning it's an ISO 7 cleanroom standard pod. The occupant breathes only clean, fresh, purified air. The second technology we use is an antimicrobial light. This is not a UV light. This is a photon disinfection light system that safely and continuously destroys airborne and surface bacteria and airborne viruses. As opposed to UV, this lighting is completely safe, but highly effective. We then use a catalytic coating within our pod to work with the light to destroy any viruses that happen to be left over that may fall to or come into contact with any surface. This means that regularly touched surfaces are no longer cross-contamination hotspots because there's a continuous disinfection process happening. Our pods are used in corporate office spaces, and they can be used, of course, to cut out distractions in the office because of the soundproof quality. But they also clean the air and purify the air, which helps staff focus. It removes headaches and dreariness and other symptoms of poor indoor air quality, but also reduces sick leave. And then in hospitals, we're installed in hospitals and healthcare facilities, such as Helsinki University Hospital, where we're installed in the maternity hospital. The pods there are used to protect new mothers and mums-to-be on their pathway through the hospital. And they're used for staff office space and for procedures. In other hospitals, we're used as post-op recovery and pre-op consultation rooms, as well as doctors' offices and workstations. We're used in universities and other educational institutions, in governmental offices and financial institutions, and transfer hubs, such as airports and train stations. What we have created is more than just a pod. It's a specialized controlled microenvironment that eliminates the harmful particles that are in the air, the airborne viruses and bacteria, but it also protects against distractions, it boosts productivity, but most importantly, it safeguards not only patients, but hospital staff. And this is done so by a continuous disinfection system that safely and quietly, but continuously disinfects the pod. We'd be happy to discuss this further with you. You can be free to make a meeting with either myself or Marko Karkainen, who takes care of our networks and network building in Asia. Thank you very much for your time, and I look forward to hearing any questions you might have. Thank you. Back to you, Sami.
Great. Thank you so much, Jonathan. And then we're going to move to the last group, where we have two companies coming from Sweden. First one is Protetiko, and we have Joachim Fong, the CEO, presenting. Joachim, over to you.
Hello, my name is Joachim Fong. I'm CEO and co-founder of Protetiko. We're a Swedish company, and I'm going to tell you about our solution for the dental industry. So our customers are dentists and dental labs who work with dental prosthetics. So basically crowns, bridges, dentures, and veneers. And of course, they want happy customers, high quality, low costs, and so on. However, today, almost all orders for dental prostheses are made with pen and paper-based processes. And this causes a lot of problems, such as errors in production and delivery, waste of materials, and most importantly, waste of time for the dentist, for the lab, and the patient, who has to come back more times than necessary to the dentist chair. Our cloud-based platform allows dentists and labs to connect in real time and manage their orders with an efficient workflow. And by automating and simplifying the order process, we can avoid errors and wasteful manual routines. Our solution brings transparency, efficiency, and security to the dental industry. To use our services, we charge a subscription fee per dentist, which is about 1,000 euros per year. And there are about 1.5 million dentists in the world, which then equates to about 1.5 billion euros in total market value, of which about half comes from the EU and North America. But this is for our core solution only. With add-ons and verticals that expand our solution, we expect the market value to more than double to about 3 billion euros. This is also a growing market with a CAG of about 8.5%. And furthermore, the dental space is currently experiencing a strong trend towards corporatization with large chains and dental service organizations. So how does the product work? Protetiko is an integration and collaboration platform that connects dental clinics and dental labs with a range of services. We provide a single place where our customers can manage their daily operations, and we have a range of add-ons that add value to our customers. And this also means that they commit themselves more and more to using our platform. As an example, we integrate with intraoral 3D scanners, practice management solutions, AI analysis for X-ray images, transportation, accounting solutions, and so on and so on. So connecting with what I said about corporatization, we provide a great tool for data mining and streamlining their businesses. We are currently working with two of Europe's largest dental chains and are rolling out to more than 2,000 dentists in Sweden. And we've also begun to enter the UK, Norway, and Finland, together with partners to provide us with access to the leading players on those markets. We have a great team with backgrounds from both global corporates and startups, having experience from retail, manufacturing, and logistics. And we have brought many ideas and innovations from those industries into the dental space, such as lean and agile. So what about the competition? There are lots of dental software providers, but the vast majority are focused on local markets and only provide service to either dentists or labs. Few try to provide services to both parties, and even fewer work on an international level. This is where Protetiko stands out. We provide a great solution that helps dentists and labs to work together more efficiently. And we can do this cross-border and in any market. Okay, so this is our forecast, and we expect rapid growth as we expand internationally. Most of our projected costs are sales related. And since our platform is in production, we expect low cost for development, except to develop more verticals. So what's our ask? We are not actively looking for funding right now. We have considered raising a Series A next year to accelerate our growth, but given the right investor, we would consider a bridge round or an earlier A round. And for this, this means connecting with an investor that is in the dental space or someone experienced in rapidly scaling B2B SaaS companies on a global level. So if you are interested in discussing how we can build the leading platform for the dental industry, please feel free to reach out to me. We're Protetiko. Thank you.
Great. Thank you so much, Joachim. And then our last company also comes from Sweden. It's Qlucore, and we have Carl Ivarsson, the president, presenting. Carl, over to you.
Yes. So we are sharing a screen here. And I guess it's working since you're not complaining. Hello, everybody. My name is Carl Ivarsson from Qlucore, and I'm going to talk to you about Qlucore Diagnostics, which is our new solution for RNA-seq-based cancer diagnostics. And the background is really that precision medicine is moving fast into the clinics and being an important tool both now and in the future for providing better treatment and drugs to patients across the globe. We are focusing on cancer diagnostics, which is in a clear transformation from being very organ-based in the beginning, over the last year being more biomarker stratification based, but now moving into precision medicine and where you need molecular information to do the right selections of treatment. And in parallel with that, the cost of so-called sequencing solutions with RNA-seq is falling and have been falling significantly over the last year, which opens up a new space of diagnostics where so-called RNA-seq-based diagnostics is being more important. But before I tell you more about that, I would like to share with you that Qlucore has been around since 2007. We have 30 industry customers around the globe. We have basically all well-known universities, both in the US and Europe, and there are more than 700 articles published in peer-reviewed journals by our customers. So we know this field. Our new offering is a visualization-driven, AI-based diagnostics software focused then on cancer, and the end customers are the clinical labs that do cancer diagnostics. It is scalable since it's built on standard pipelines, which lowers the costs for the labs. It is one tool that can be used for many types of diagnosis, again, driving down cost and ease of use. And there is also the possibility to visualize data in a way that no one else can do, which makes it easier to communicate results to patients, for instance. So here is an example where the classified patient is the blue one here with a label belonging to that group, and you see from the 3D plot here that it also seems to be very close to the red group, which is a much more communicative way than a long PDF report. You will, of course, get the PDF report too with Qlucore Diagnostics. We have a prototype that is used by labs. We have a leukemia, ALL, based classifier that is ready and testing with good performance. And we have good traction from the Nordic region with both public and one commercial contract based on a public EU tender. for Qlucore diagnostics. We are right now expanding, so we are doing 2 rounds that are decided. We are this year going to close a pre-IPO round for $3 million US approximately, and then we will do an IPO within approximately 12 months. And we are going to use that fund to ramp up sales and ramp up our organization with expertise in the areas that we currently are covering with consultants, and we're going to strive for a CE mark of this product. So that's all from me. So if you're interested, let me know. Thank you.
All right, thank you so much, Carl. And now it's time to move on then to the Q&A phase. So, like mentioned earlier, you can post your questions using the Q&A functions, or then you can also connect the companies later on. We will post the link again in the chat. And it's also here. But let's move forward then to the questions from the audience. Please also remember to indicate then to which company your question is for. Okay. Seems really the technical moons are not aligned for us today, so thanks for your patience with all of those. But we have one question from the audience. This question is for Quppa, and it would we be interested in the new shareholders? Do we have Sami from Quppa to answer the question? Okay. And then we have one question for retina risk, Silla. It's about the valuation. So if you're raising 1 million euros, at what valuation? Silla, you are muted.
Sorry? Yeah, we are raising at 4 million valuation.
Okay, thank you for that. Do we have any other questions? And next question is for Adesante. For what do you plan to use the funding that you are now raising? Petteri.
Sorry, could you repeat some of the question? What do we?
What is the plan for the funding that you're currently raising?
It is for scaling up in Asia, Europe and Middle East, and taking the product to the next level. Let's say taking this or finalizing this AI and machine learning and taking it into the product properly, and then spending some of the investment, let's say, from a 3 million investment, 2 million for R&D in overall, and 1+ million for scaling up.
Okay, thank you, Petteri. And for Nestor, yes, we will share all the presentation decks later on. In 24 hours, we will send a thank you email for the participants, including this recording and also all the presentation decks from the companies.
And it's Petteri here again. And if someone is interested about more in details to see how it will be spent, I have a dedicated calculation table for that, including in header level all the tasks, how the investment is planned to use.
Good, thank you, Petteri. And all the companies, please remember to include your contact details, the presentations, what we are sharing with the participants. So if there are any further follow-up questions, then they know. All right, and then the next question is for Secapp. What are your plans for local presence in Southeast Asia? Do we have Dr. Kari still on the line?
Yep, still here. Our local presence in terms of Southeast Asia is that we are looking for partners. So local distributors would be the #1 model that we would look for in the Asian market, as well as what we do in general in all of the markets. So we try to find a local partner that can take the responsibility of the distribution and of course the customer relationship. But of course, meanwhile, while we are doing that, we of course try to find first proof of concept customers within the region, so that can be later given to the distributor as well to manage. And this is the same model that we've done, for instance, in Middle East. So what we did there is that we have a local distributor, which is called the Saudi Telecom Company. It's $1 billion telecom operator who's selling Secapp there in their market, and we kind of we support that from a technical platform perspective.
Okay, good. Thank you, Kari, for that answer. Do we have any more questions from the audience? Okay, and the next question is for CryoTech. So you were highlighting in your presentation about the wellness and the sports, and how about the hospitals and other potential healthcare users?
Hi, this is Mare. I'm answering. Yes, we have. We started with the sports mainly, and now we are. Sorry. Okay. Now we started with the sports teams and sports, but we are now mainly working with the physiotherapists and also with the big hospitals, as here in Finland, also in the Nordic companies. So it's actually more with the physios and recovery from surgeries and rehabilitations and pain management at the moment.
Okay, good. Thank you, Mare. And do we have any more questions from the audience? Right. But if no more questions, we would like to thank you for your time and your participation, and also your patience with our technical challenges today. Stay safe and have a great week ahead, everybody. Thank you so much for joining us today.
Thank you. Bye.
Thanks a lot.
Thank you.
Bye-bye.
Bye-bye.